Good morning, everyone. I'm very happy to be with you today, even though not physically. I unfortunately wasn't able to be there. Hence why I'm addressing this presentation from the past, but potentially talking about very important future topics to be discussed. So today I was asked to bring a little bit more insights on understanding zoonotic threats for global health security, and hopefully this will generate a good discussion amongst the participants that are there with you today. So basically, I would simply like to start by having a bit of an overview on major epidemic and pandemic threats from over the past years. And this basically, we can take a couple of them into consideration from Ebola to COVID. We have seen some major global health crises recently. And I believe that these events emphasize the urgent need for preparedness, for collaboration, and also for us to rethink and shift a little bit the actions in how we have been addressing epidemics and pandemics. And all of those, they were characterized by its devastating impacts on communities, on healthcare systems, on the environment, and our ways of behaving and living. And they all highlighted the need for us to swift global responses and collaborative efforts to contain virulent diseases. And this specific events, they basically underscored the importance of preparedness and solidarity in combating infectious diseases. Um, I think that our most recent example, the COVID-19 pandemic, really tested our resilience on a global scale. All of us in different countries, we faced similar situations, and all these societal implications, they have reshaped our economies and also our daily lives. So this basically reinforced the connections that we have nowadays, and the importance of each of the sectors, multiple sectors that are engaged and mobilized on a pandemic response, the different stakeholders, how we are addressing science through all that, and how international cooperation have been key to address health emergencies. Um, Going into the regional context, a little bit on Asia Pacific, this is just an overview of the previous public health emergencies that we have faced in Asia Pacific. You will see that they vary from natural disasters. Some are related to foodborne diseases, a couple of others related to zoonotic diseases, and you will see that the ones that are actually in black, they are global events, and a couple of them highlighted as graded events, but just to see how much exposure our region is it's having now. And by bringing zoonotic diseases into the context, I believe that the amount of zoonotic diseases that we have or that are related to emerging diseases, emerging infectious diseases, are very high. So as you can see, we have very high percentage of current human diseases that are from zoonotic origins. And we also have a good amount of diseases, of emerging human diseases that are zoonotic. So this brings us to think about and also to discuss what are these drivers and these changes that are bringing health risks with pandemic potential into our daily routine, let's say. And if you bear with me just for a couple of moments and we start to establish like a mindset here. So we have an important pressure in terms of population growth. So we are taking into consideration that uh, by the United Nations perspectives, we would be around almost 10 billion humans by 2050. And once we have the population growth, we basically have an increased on the food demand. So not only in terms of supplying and feeding the whole population, but also what are the food consumption patterns, food production patterns, reason why we have also a push and an increase in agricultural and livestock productions to be able to cope with this demand. And well, let's add even more there, because we do have an increase in terms of numbers to different types of livestock productions, and also in how we're actually using the land. How are we using the land in terms of grazing, in terms of cropping production, and also how are we using the land that we have in terms of comparing urbanization and deforestation. So over the past 10,000 years, the world has lost more or less a third of its forest, and we still increasing on the deforestation rates. That's almost totalizing 4 billion hectares. So, and once we touch on the deforestation, we are also seeing a decrease in terms of biodiversity, in terms of fauna, in terms of flora. And of course, to maintain and to sustain all of that, we also have a reduced number of resources that are available for us to cope with this cycle. Other major players and other major drivers that we have to take also into consideration, it's globalization. Nowadays, it's very easy for us to move around for our products, for our animals, and also for our microbes to travel around. It's much easier for us to ship products. It's much easier and quicker for us to travel from one side to the other side of the globe. And this also increases the interactions that we have worldwide. Climate change, we cannot not talk about, mention climate change. All these actions that we take to maintain food production, to sustain our daily life, they are impacting, they are having an impact on the environment. So climate change is something that should be taken into consideration once we are looking at the broader scope. We have an aspect in animal trade, but more considering wildlife trade in terms of different pathogens and different animals that are being moved. And this is also impacting the biodiversity decrease. There are relations on that, on animal trafficking and poverty and inequality. The whole system and the whole community involvement in all these drivers and these changes at the human-animal environment interface. And for this, we do have health risks that are increasing and being more visible from our lens. So once we move to pandemic prevention and preparedness and response, we also need to take into consideration multi-sectoral approaches. So from the previous experiences that we had, we are still facing challenges to address what we have learned or what we should have learned from the previous pandemics in terms of multi-sectoral collaboration and multi-sectoral coordination. How can we avoid panic? How can we get out of this cycle of not feeling prepared enough for future pandemics, or how to best prepare for what it's potentially to come? So basically, for when we talk about prevention and preparedness in terms of financial investments, once we are able to address things on a peacetime, the costs are much lower than when we are actually responding to one of this type of incidents. So, and for this, bringing the multi-sectoral scope for that, we cannot not mention the One Health approach. So once we're talking about One Health, we're talking about the connection between this interface between humans, animals, and the environment. But we're also talking about the different sectors, the different disciplines, and the whole of the society acting on an integrated manner to improve coordination, collaboration, enhance capacity building, but also improve and establish a good communication. So this is the definition, the recent definition by the One Health high-level expert panel, which is basically the definition that the One Health quadripartite, which is composed by the WHO, the World Health Organization, the Food and Agriculture Organization of the United Nations, FAO, the World Organization for Animal Health, WOA, and also by our most recent member, the United Nations Environment Program, UNEP. But overall, why are we thinking about One Health? We are thinking about a systems approach. We're trying to leave the silo type of work that we have, and we are indeed focusing on collaboration, coordination, establishing good communication channels in a way that they are effective, and also considering not only the enforcement of capacity building within the different sectors and for the different stakeholders, but also considering resource mobilization. Because for us to be able to work around all that, resources are very important. Still on talking about the prevention of zoonotic spillover, zoonotic diseases spillover. So basically, one of the most recent definitions for prevention of zoonotic spillover was also done by the One Health high-level expert panel. And ideally, this includes all the drivers that we have that I have mentioned previously, but taking into consideration all the ecological aspects, meteorological aspects, anthropogenic factors, and how we can consider those to reduce the risk of human infection with zoonotic diseases. And of course, by all of that, different ways to achieve that, but taking into consideration the biosurveillance in natural hosts, in the humans, and also in the environment. Because one single type of analysis is not enough for us to understand the dynamics of the pathogens and then to be able to address it by implementing interventions that are going to be effective to this. I'm pretty much sure that you have our colleagues from the quadripartite in the room today. And just to touch a little bit on the One Health quadripartite and all about this commitment towards the One Health. So basically, previously called as a tripartite, but recently, as I previously mentioned, having UNEP joining the quadripartite as of 2022. And all this started with three major topics: antimicrobial resistance, avian influenza, and rabies, but not only addressing it, but now working together to be able to prevent, predict, detect, and respond to health threats that are comprised at the human-animal environment interface. Also, to continue building on the work that the quadripartite has been doing. So I would like to mention the One Health Joint Plan of Action and the different 6 action tracks that it comprises. So basically, different technical areas that are being taken into consideration in this plan specifically. The plan was launched last year too. And one of the action tracks focusing on strengthening capacities within the different systems, the different health systems, but followed by one focusing on emerging zoonotic diseases with epidemic and pandemic potential. One also focusing on zoonoses, but not only on zoonoses, also neglected tropical diseases, endemic zoonotic diseases, and vector-borne diseases. Another one focusing on food safety, one dedicated to antimicrobial resistance, and one, of course, taking the integration of the environment into all the One Health work. And basically, these are the 6 action tracks that the One Health quadripartite has been working on. And well, here in Asia Pacific, we also have our mechanism to coordinate. So we do have the 4 agencies and a total of 8 different offices that are engaged in coordinating actions and joint implementing actions and rolling out different activities throughout Asia Pacific. We currently have our secretariat with the WHO Seattle, Southeast Asia Regional Office. This has been a very good, well-established relationship over the past years. And just to give a glance on how the regional quadripartite coordinates, basically we do have our coordination with the Global Quadripartite Secretariat, which are based in our headquarters. But further to that, we have our regional teams working together not only on the management aspects, but also on technical working groups, and the regional quadripartite also coordinating with the member states and the countries that we have, the members that we have here in Asia Pacific, and also with other regional partners, which varies between donor agencies, academia, NGOs, and many others that are working on One Health agendas in Asia Pacific. As mentioned, we also have our technical working groups. They are all following the different action tracks that we have in the One Health Joint Plan of Action, and also focusing on communication and risk communication. So we're able to deliver and to joint implement the actions within these technical areas. As WHO and how WHO has been contributing to health security and pandemic prevention, preparedness, and response. So in our region, we do have, in our region, we do have a vision to be prepared and to be able to have a resilient region once it comes to responses for public health emergencies. And this is pretty much taking into consideration a whole of government and whole of society approach to all the major public health events that will be impacting not only health, but also the economy and the society. Based on that, we do have bi-regional framework for Asia Pacific that is taken into consideration different domains. It was just updated and built on previous on the previous framework that was available, but taking into consideration different domains that are addressing different areas such as health and how the health system capacity can be strengthened to address that. It's looking into the social scope, taking into consideration all the consequences that public health events can have in employment, in discrimination, in domestic violence, and other inequities that are related to social aspects. How much these are also related to education and also the economy that are there in different areas in the society. So this addresses One Health for sectors to be able to work on the One Health approach and address the multi-sector collaboration that is eventually needed to respond to this type of events. And we also have a vision in the region that we promote the health beyond the health sector, and one of the priority action areas is health security, including antimicrobial resistance. When we talk about multi-sector collaboration at the human-animal environment interface, we are also addressing how to strengthen this coordination and collaboration among sectors, in which we also bring from the human health side, the international health regulations, joint external evaluations, evaluation and respective tools, national action plans for health security, and how this is also related to the animal health sector when it comes to their own types of evaluations for the veterinary services. And for this, I also bring into the highlight the performance of veterinary services that is similar. It's a similar type of evaluation to the JE, the Joint External Evaluation, and how this can how these are bridged and correlated. So basically how this collaboration can be assessed, how this can be jointly planned, and how the implementation of these priority areas are to take place. And then, of course, prioritizing and addressing specific needs. So when it comes to prevention across the human, animal, and the environment spectrum, once we talk about public health threats, especially zoonoses, these will continue to grow, and they are going to continue increasing the complexity and impact of what we have to do. And to be able to address that properly, we need to have an enabling environment. We have to have an enabling environment with One Health capacities and touching on infrastructure, on resources, on advocacy for the approach, on finance, and also regulatory frameworks that are comprehensive enough for this environment to be operational. We are also bringing, and we need to further understand the drivers of emergence and the spillover and spread of zoonotic diseases. And by that, have a coordinated and collaborative approach. So strengthening multi-sectoral coordination, strengthening this collaboration for surveillance, for early warning, for response, or for any specific part of the system, it's key to be able to move ahead. And then also how the community and the whole of society needs to be taken into consideration. A pandemic, it starts and it ends with communities. The communities are the ones that are going to be most affected. And this is one of the key players that should be looked with more details. And of course, without communication, we are unable to move ahead. We are unable to be aligned, and we are unable to be moving towards the same direction. So having a good communication and information management systems are also very important for that. I will stop here. I'm pretty much sure that my colleagues are going to be exploring further different aspects of the presentation. And I'm wishing you a very good and productive event, and hope to be with you very soon. Thank you very much.